What if I told you that much of what you know about back pain is completely wrong? Today, we're uncovering the truth behind the top 7 myths about back pain. These myths not only prevent you from effectively managing your condition, but they also cause unnecessary worry and keep you from living an active life. Join me as we debunk these misconceptions and equip you with the knowledge to make informed decisions. It's time to take back control of your health. Hey everyone, Dr. Jeff Peng here. Let's start with myth number 1. Back pain is usually a serious medical condition. This is one of the most pervasive myths about back pain, leading to unnecessary fear and anxiety. And while it is true that serious conditions like vertebral fractures, spinal infections, and cancer can cause back pain, these are rare. Research shows that the vast majority of back pain cases do not exhibit the red flag features associated with these severe conditions. Most lower back pain is due to musculoskeletal issues such as muscle strains or ligament sprains, which can be effectively managed with proper care. Understanding that lower back pain is rarely a sign of serious life-threatening condition can help reduce stress and encourage you to seek appropriate non-invasive treatments that promote recovery and overall well-being. This brings us nicely to myth number 2. Imaging scans such as X-rays or MRIs are always needed to detect the cause of back pain. This misconception often leads to unnecessary medical imaging, increased healthcare costs, and added anxiety. The reality is that scans are not always necessary and often do not provide useful information for diagnosing or treating lower back pain. One reason is the normal variation and aging within the human population. Studies show that spinal abnormalities are common even in people without symptoms. For example, data from 33 studies involving 3,110 asymptomatic individuals reveal that 37% of people in their 20s show signs of disc degeneration. This increases to 68% of people in their 40s and as high as 96% of people in their 80s. And despite these findings, all these individuals were completely asymptomatic. This suggests that many image-detected changes are simply normal wear and tear and do not necessarily represent something pathological. Furthermore, scans do not determine the prognosis of the current episode of back pain, the likelihood of future disability, or improve clinical outcomes. In fact, relying on imaging can sometimes lead to worse patient outcomes and unnecessary procedures. Seeing abnormalities can cause stress and anxiety, even though they are usually unimportant. Back pain can often be effectively managed with a thorough clinical evaluation and conservative treatments such as physical therapy, exercise therapy, and lifestyle modifications. Another common myth about lower back pain is the belief that pain related to exercise and movement always signals harm being done to the spine, indicating the need to stop or modify activity. This misconception can lead to an unnecessary fear of movement and exercise, ultimately exacerbating the problem. The truth is that graduated exercise and movement in all directions are actually safe and beneficial for the spine. Pain does not necessarily indicate damage. Rather, it can be a normal response to physical activity, especially when starting a new exercise regimen or increasing intensity. Engaging in controlled, progressive physical activity helps to strengthen the muscles supporting the spine, improve flexibility, and promote overall spine health. Additionally, there is a misconception that acute back pain flare-ups are a sign of tissue damage and require rest. A Cochrane review found that for patients with acute low back pain, advice to stay active led to improvements in pain relief and functional status compared to advice to rest in bed. Pain flare-ups are more often related to changes in activity, stress, and mood rather than actual structural damage. Even poor sleep has been linked to worsening back pain. The next myth is that treatments such as strong medications, injections, and surgery are both effective and necessary for managing lower back pain. This belief can lead individuals to pursue invasive and costly interventions without exploring other options. The reality is that effective care for lower back pain is often relatively cheap and safe. Many people believe they need an epidural cortisone injection to alleviate severe back pain. And while these procedures can reduce pain, the therapeutic effects of exercise and physical therapy are often underestimated. For instance, a study found that both epidural steroid injections and physical therapy significantly improved pain and function with no difference between the two treatment groups. Research shows that focusing on education, fostering a positive mindset, and optimizing physical and mental health are key components in managing and alleviating lower back pain. Non-invasive treatments like physical therapy, regular exercise, proper ergonomics, and cognitive behavioral strategies can be highly effective. The next myth about lower back pain is the belief that it will become persistent and worsen with age. Many people also worry that aging will lead to or exacerbate back pain. However, research does not support these notions. These misconceptions can cause unnecessary fear and resignation, preventing individuals from taking proactive steps to manage their condition. In reality, most episodes of lower back pain improve over time and do not worsen with age. Factors such as negative mindset, fear avoidance behavior, negative recovery expectations, and poor pain coping strategies are more strongly associated with persistent pain than actual tissue damage. Addressing these psychological and behavioral factors is crucial in managing and overcoming back pain. Another pervasive myth is the belief that repeated spinal loading inevitably results in wear and tear and tissue damage. This misconception can cause people to avoid activities that involve spine movement, fearing long-term harm. The truth is that spine movement and loading, when done in a controlled and graded manner, are not only safe, but also beneficial. Regular, appropriate loading of the spine helps to build structural resilience and strength, promoting overall spine health. Avoiding movement can actually weaken the spine and surrounding muscles, which can then increase the risk of injury. Embracing a routine that includes graded exercise and movement can enhance spinal stability and functionality. The final myth we need to debunk is that poor posture is the main cause of back pain. And while maintaining good posture is important for overall musculoskeletal health, it is not the sole or even the primary cause of back pain for most people. Multiple systematic reviews have examined the association between spinal postures and low back pain. One study found no consensus on the causality between spinal postures or physical exposure and low back pain. Additionally, other studies investigating awkward occupational postures concluded that there is strong evidence indicating no association between awkward postures and low back pain. It's important to remember that back pain is multifactorial, often arising from a combination of physical, psychological, and lifestyle factors. These can include muscle imbalances, lack of physical activity, stress, poor sleep, and even genetic predispositions. And while poor posture can contribute to discomfort and exacerbate existing conditions, it is rarely the root cause of chronic back pain. Understanding the truth about back pain can transform your approach to managing it. Now that we've dispelled some common misconceptions, it's time to take action. Don't let back pain control your life any longer. In the next video, I'm going to show you a highly effective 5-minute exercise and stretching regimen that can provide immediate relief and long-term benefits. Check it out next, and thanks for watching.